Good afternoon, everyone, and welcome to our today's Facebook Live. My name is Shafiq Qureshi, and I work for the Fairfax County Health Department as a senior community health specialist. I conduct public health outreach in the Muslim and South Asian communities. And as you all know that millions of Muslims will be taking part in the month of Ramadan, and Virginia is the home for about one quarter of Muslims, and they will be celebrating month of Ramadan, and they will be celebrating fasting tomorrow on March 23rd. And Muslim community will be fasting from dawn to sunset. And during at this time, it's very vital or important that our Muslim community take care of their diets in order to ensure that their bodies can cope with the sudden changes in their normal routine. And today's our Facebook Live. We have the honor of speaking with Imam Farhan Siddiqui, the resident Imam and the Director of Religions Affairs. And he will be talking about the healthy fasting during the month of Ramadan. And our today's topic is healthy tips for the meaningful Ramadan. So we welcome Imam Farhan. Welcome Imam Farhan to our Facebook Live. And I will start with, if you can please tell us about Dar Hijra Islamic Center and the community you serve.
Sure. Dar Hijra Islamic Center is probably the most diverse Islamic center in the Northern Virginia area. We cater to, I believe, over 50 different ethnicities and languages. We actually have classes in multiple languages in the center. Some of the more popular languages that we have, I believe, are Amharic, after Arabic, and English, obviously. We do have a few Spanish-speaking members of the community. We also have classes in Dari and Pashto.
So it looks like Dar Hijra Islamic Centers, they provide services to very diverse populations. And I have been to Dar Hijra Islamic Center in different events, especially our food pantry. And so you can imagine that how diversity it has when you provide the food pantry. Most of them like Hispanic community, South African community, and other people from other ethnic groups. That's very good, and I'm glad to hear about that. And also, my next question is if you can share with us about the fasting. What fasting means in Islam, and why do you fast, and who fasts in the month of Ramadan?
When we talk about fasting Islamically, there are two ways that we generally address fasting. One of them is in a linguistic sense, which basically means to withhold. In a spiritual sense, it's the act of abstaining from eating, drinking, and intimacy with your spouse from dawn until sunset. And it applies to every Muslim adult.
And about when you come about the fasting, and so you said that abstain from eating and drinking. So can you tell us about like from what time to what time?
Sure. So I believe dawn comes in at about 6:15 or so, and then sunset is close to 7:30. So from 6:15 a.m. until 7:30 p.m., a person will abstain from eating, drinking, and intimacy with the spouse.
And maybe the days changes and the time will change during the time.
So I guess we're getting closer to the summer solstice, so the days are just going to get progressively longer.
Perfect. So great information, and it means that healthy adult Muslims are required to fast each day from dawn to dusk. And this includes like abstaining from drinking, eating, and immoral acts, and also anger. And Ramadan teaches us patience and self-control, and it's very important that we practice patience and self-control in the month of Ramadan and throughout our life. And my next question is every adult Muslim required fasting during the month of Ramadan?
Yes, there are some exceptional cases. Those exceptional cases in general include the travelers. So if an individual is traveling, he has a choice on whether he wants to fast or not. If an individual is sick, or if a woman is pregnant or feeding.
So if a woman is pregnant or breastfeeding, so there's some way exceptions that she can not fast during the month of Ramadan, but is there any way that she can compensate that when she is healthy, and so how it works?
Sure. So even if an individual is, whether he's traveling or he's ill, or he, or if a woman is pregnant or feeding, she actually all of them have a choice. It's not necessary that they take advantage of the exception. What I usually advise everyone, because the fast is a very personal act of worship, is that they go to their doctor and they consult with their doctor, asking them, like, if I fast, what are some of the health consequences that I have? And then at that point, they would go back to a religious scholar, and then that religious scholar would be able to give them a final edict on whether they actually apply for the exemption or not. And if an individual actually cannot fast, there are two separate situations. So there's somebody who's in a terminal situation, meaning that for long periods of time, either due to the fact that he's elderly or they have some type of terminal illness in which they can't fast and it will adversely affect their health, they pay something that's called a fidya, which is a compensation. And the compensation is basically when you pay one meal for every day that you're unable to fast. And that can apply to certain women. So, for example, if a woman is in a cycle, she has 6 children, for example, and she's constantly in a cycle of feeding and, in pregnancy, and she's missed so many fasts that it's unrealistic for her to really make up those fasts. She's also in that category, and she can pay on that behalf, and she can pay this fidya.
That's good. It helps us to keep her health. And also, if someone is sick or ill, and it's better that he or she can consult with the doctor before he or she can make any decision on fasting, especially those people who are suffering from like chronic disease such as diabetes, or some may have chronic heart diseases. So it's always better that if a ill person can consult with the doctor, and he or she can discuss, as you said, same with the Islamic scholars, that what are some ways that can make up of the missing fastings, and how to take care of their health during the month of Ramadan. Thank you for sharing. And also, please tell us about healthy ways and some tips for successful fasting during the month of Ramadan.
Sure. So I'm not a nutritionist, so I just want to be very clear. But it's very important for us to understand that there are different aspects to our health.
Mm-hmm.
We have our spiritual health, and Ramadan is here because the goal of it, as God says in the Quran, is that لَعَلَّكُمْ تَتَّقُونَ, so that you may achieve God consciousness.
Mm-hmm.
So achieving that God consciousness in a state where an individual is unable to, eat or drink or to be intimate, and if you actually remove these individual elements from a person, you'll find that they end up being frustrated. And many of us might experience this when we go to like a restaurant and the food hasn't come. So what happens, right? we get frustrated. And it is in those moments, and I believe that God has kind of cornered us in those moments to to decide for us and to help us navigate our frustrations. So having that spiritual health is really important. Physical health, talk to a nutritionist. I think that's something that's really important that many of us might actually overlook. I can give some prophetic guidance to that.
This would be great.
Sure. So the Prophet Muhammad, he said that in the suhoor barakah, that he says that in the morning meal and the pre-dawn meal there is a blessing. So make sure you take it, even if it's a small amount. He actually used to break his fasts on just a very small meal. Sometimes it would just be dates and water, and I believe that some of that has to do with making sure that there's that idea of portion control, which I think is also important in making sure that we have balanced nutrition.
Thank you very much for providing these useful tips. So eating like pre-dawn meal is very important. That can keep your energy level up during the daytime. It's very important. And also during the iftar time, iftar time is when you break your fasting in the sunset time. So it's very important to eat some healthy food and avoid some spicy junk food, and so it will help a lot to boost your immunity.
Yeah, yes. Unfortunately, culturally, we don't really do that.
Yes, but
our foods tend to be very deep fried and fatty.
But we should educate our community about eating pre-dawn meal, and also what they need to eat during the iftar time or the fasting time, break fasting time. Thank you very much. And also when we talk about the community, the Ramadan is the special time that we all in the community get together with each other. So when you talk about the community, can you tell us more about the community and social aspects of the month of Ramadan, and how the community get together and how they can support and help each other?
Sure. So actually here at Dawah Hijra, we have 2 parallel programs. Mm-hmm. One of them is the iftar program. The iftar program, we feed anywhere between 800 to 1,200 people a day. And those are individual meals that are given out, in addition to the 100 meals that we deliver to people who are unable to come to the masjid. Mm-hmm. So it is a very diverse and inclusive program that we are promoting here at the masjid. And everyone is welcome. There's no one who is denied. There's no selection process to people who can come in. If you are here, you're more than welcome to join us. And that is part of the community service that we are here to provide. It provides that social aspect, that social atmosphere that people can actually come together. They can converse. It's an opportunity for us to check on each other and to really enjoy breaking the fast together. Our Prophet Muhammad, he says that there are 2 times of happiness for the person who's fasting. The moment when he breaks his fast and when he meets his Lord.
Thank you very much. Yes, exactly. Ramadan is the time to build the community and reach out to each other for the support. And also this opportunity, as you mentioned there, to check on each other, to take care of each other. And this is the opportunity that we can create a healthy community. And also in terms of the socialization, so this is the only way that people they come together and socialize with each other. I can give you my own example. So in the month of Ramadan, as a Muslim family, I was taking my family to the mosque every day, and I was driving like almost 30 minutes. So now I live more further from before where I was living, and so I drive like 1.5 hours to meet my own community, especially on weekends, not every day during the month of Ramadan, to just socialize with our community and help us, spiritually, mentally. And it's also our children, they learn about their culture, so it's very important for our children, they learn about their culture and practice some cultural norms. It's very important. Thank you, Imam Farhan, for telling us all this great information you share with our community. And dear fellow Muslims, if you decide to fast, please don't skip the pre-dawn meals and our called suhoor meal. And to ensure that suhoor meals contains a lot of fluids, and also some dairy products such as cheese and yogurt, as well as fruit, and avoid some sugary food during the pre-dawn meal. And also make sure that iftar includes complex carbohydrates in other slow digesting foods, and also avoid spicy food and caffeine-based drinks. And if you have any pre-existing medical conditions, as I mentioned earlier, like some chronic disease such as diabetes or any other chronic heart disease, please consult with your healthcare professional before making any changes to your diet or lifestyle. And also for more information, you can visit our Fairfax County Health Department website at www.fairfaxcounty.gov/health. And I wish our fellow Muslim a safe and healthy Ramadan. And you all have a great day and Ramadan Mubarak. Thank you.
So,
Thank you, Mo Farhan.
yeah, no, it was my pleasure.